Now, nerve pain's a little bit different in terms of some of the mechanisms. We won't get into the details of that, but these are common drugs. Aside from, now many doctors will also use steroids, and they will also use non-steroidal anti-inflammatories to treat nerve pain. But these are some drugs specifically that are used to treat nerve pain as well, very commonly. Tricyclic antidepressants, so the class of antidepressant medications oftentimes have an impact on people's perception of pain, and there are a lot of different examples here, amitriptyline being one of the more common ones. And you can see these medications cause vitamin B2 deficiency and CoQ10 deficiency. Now, why is that important? Is that CoQ10 deficiency causes myalgia, muscle pain. Vitamin B2 deficiency can also cause myalgia. So again, using these medicines long-term chronically can cause muscle pain. Now that's different than nerve pain. So you're treating your nerve pain and you're trading it for muscle pain. And that's again another example of a loop we want to try to avoid. We also see a lot of times doctors will use the class of medications called SSRIs, selective serotonin reuptake inhibitors, as well as selective norepinephrine reuptake inhibitors. And so examples here, venlafaxine, duloxetine, citalopram, etc. These medicines cause vitamin D and calcium deficiency. Now, what we just said a moment ago about vitamin D and calcium is that for nonspecific musculoskeletal pain, these nutrients work to help relieve pain. So again, coming back up to that, these deficiencies, you're trading nerve pain for muscle pain. So you want to be aware of that. Again, have the conversation with your doctor about the nutritional depletions that can be caused by those, and make sure, even if your doctor's ignoring it, that you're not. You don't have to sit on the sideline and let your doctor run and call all the shots. You should be the quarterback of your health. If your doctor's the quarterback of your health, just know this: he doesn't care about you or love you more than you do. So you're probably going to occupy 5 minutes of his time when you're in the appointment, and beyond that appointment, you're probably not occupying any degree of his mind or his mind space. Now let's talk about some of the other common medications used to treat nerve pain, anticonvulsants. And so these are drugs typically used to treat seizure, but doctors have started to use them also to treat different types of nerve pain. Some of the more common ones used nowadays, like gabapentin or pregabalin or Lyrica, these are drugs that affect the nervous system through varying degrees, but they're more classified as anticonvulsants really than they are as pain medications, but they're being used for people with nerve pain. Now these classes of medications have a lot of issues too. They can deplete calcium, carnitine, vitamin D, vitamin K, B vitamins like 1, 3, 6, and 12, and folate and biotin are also B vitamins, as well as inositol. So this is a pretty long list of nutritional deficiencies, and we know that, as we've already talked about during the show, calcium deficiency increases pain, vitamin D deficiency increases pain, B vitamin deficiency increases pain. In my experience, inositol deficiency increases pain. It also causes reduced thyroid function. Reduced thyroid function leads to muscle loss and atrophy, which also increases pain, as I showed you earlier. So there's kind of a whole correlation of things that can happen downstream from these nutritional deficiencies. We also know that carnitine deficiency can cause myalgia, muscle pain. Carnitine being a very important nutrient. It's the taxi cab or the shuttle for fat, so it helps your body burn fat as energy. A lot of people going on ketogenic diets need more carnitine in their diet to burn that fat as fuel, but these medicines cause or can contribute to carnitine deficiency, so it's important that you understand that connection. Okay, let's see here. Oh, I want to back up just a little bit. I had some other studies I wanted to talk to you about. So here we have, I was talking about SSRIs a moment ago. I want to make just make an observation for you about this class of medications. This is a very common prescribed drug, and even if you don't have chronic pain, a lot of you may have been prescribed this drug to treat depression or anxiety because it's more commonly used to treat those types of situations or conditions. But You see here in this study, and there have been a number of studies demonstrating this, but this particular one was a systemic review and meta-analysis of many different studies, finding that this class of medications, SSRIs, demonstrate the use of these drugs, okay, associated with lower BMD values. That's bone mineral density. And the reason I'm pointing this out, some of you may think, well, what does bone mineral density have to do with pain? Well, if you're taking a drug to treat your pain that causes your bone to become less dense, then you increase the risk for things like bone pain and bone fracture, which will also hurt. And so again, you're opening yourself up. So we said some of these other drugs cause muscle loss. And now we're saying some of them cause bone loss. So that's your musculoskeletal system basically being deteriorated by the very drugs that you're taking to try to reduce the pain of your musculoskeletal system. To me, again, it's a loop. You don't want to get stuck in that loop. If you can prevent it, if you understand it, you can make intelligent decisions about how you want to deal with it and not just rely on your doctor to tell you, oh, don't worry about the side effects. Those are so rare. What's what we always hear? The side effects are rare. How many of you have ever been told, oh, don't worry about the side effects. The side effects are rare? Type that in below. Share with me if that's something your doctor's told you, and then you went home and then proceeded to have the very side effects that were so rare. But last thing I want to talk about is the influence of dietary supplementation on neuropathic pain. This was a major review published a few years ago. And I think it's important to point out because so many, again, doctors ignore this, and they shouldn't, because the power of nutrition and nutrients to address pain is very, very prolific. You see here several pharmacologic approaches exist for nerve pain. However, they can lead to numerous adverse effects. It's what we just talked about. From this perspective, the use of nutraceuticals and diet supplements can be helpful in relief of neuropathic pain and related symptoms. In this review, we discuss how diet can radically affect peripheral neuropathy, and we focus on the potential approaches to ameliorate this condition, such as the use of numerous nutritional supplements or probiotics. Now, I'm not going to get into the entirety of what they talked about in this review. I will say this: if you're really struggling with neurological pain, you want to consider alpha lipoic acid. You want to definitely consider a B complex. Those are safe to take. They're not going to harm you. They're not going to interfere with your medications. Relatively inexpensive to do and can have profound impacts. Now, you might also consider calcium, magnesium, vitamin D, vitamin C, vitamin E, quercetin and other bioflavonoids. And you might also consider CBD if you have or struggle with these pains. These are all fantastic supplements that can play major supportive roles and help you out of this bind. Now, that being said, I've done a full comprehensive video on this very topic. You can check that video out right here. I also invite you to watch the rest of this series on drug-induced nutritional deficiencies from commonly prescribed medications. You can check that out down here. Thanks so much for tuning into Dr. Osborne's Zone. Make sure you share this with 10 other people you know, because together we can get this information out and help save lives and change the world. Thanks so much.